Hello everyone, this is Cindy Crook with DRH Marketing, and it's time for Facebook Live. And this month is National Hospice Month. And so I've invited Makensi Garza, who's an RN with Chisholm Hospice, to talk about hospice. And thank you, Makensi, really appreciate it.
Glad to be here.
Hospice is a tough subject. It's a needed service very much, but it's a tough subject. And so why don't you tell us about hospice, what it means and what it offers people?
Great. Thank you, Cindy. All right, so like she said, this is National Hospice Month, and I'm here to hopefully answer some of your questions and tell you a little bit about our hospice services here at Duncan Regional. Hospice is end-of-life care for terminally ill patients and their families. Every year, about 1.4 million people in the United States receive hospice care. Hospice is derived from a medieval term that means a place of shelter for travelers on a difficult journey. So with hospice, it's the journey of the final journey and possibly the most important journey for them. We as hospice professionals ensure that patients and family find dignity, respect, and love during life's most difficult journey. Hospice is not a place, but high quality care that enables patients and families to focus on living as fully as possible despite the life-limiting or terminal illness. So since this is National Hospice and Palliative Care Month, I'm here to raise awareness about hospice services and hopefully answer those questions. This year's theme is it's about how you live. Why? Because people need to acknowledge and accept that people die. We also need to understand why people die and that it's a natural process. Just because one is declining in health does not mean that we as healthcare professionals have failed. It's a psychological process rather than a chronological process. And once we've understood that and accept that natural process, we can confidently begin asking, how do you want to live instead of how do you want to die? Often when one is very ill or continuing down a road of decline, there's multiple times they're going back and forth to the hospital and trying to get better, and they just don't. And so when hospice steps in, we try to minimize that time that's spent on medical appointments and receiving care, and instead being able to make memories with your family, staying at home. Our primary goal is to help the patient be comfortable and more able to enjoy life. So there tends to be a negative impression of hospice and palliative care, but hopefully as we increase this awareness, the awareness of these services, we can help you better understand how you want to live. So I'm going to talk just a little bit about some of the things that Chisholm Trail Hospice can provide. We provide 24-hour nursing care along with emotional and spiritual support for not only the patient but their families as well. We provide all the equipment and medications that are needed for the patient and equipment that goes as far as a bed, a wheelchair, bedside commode, anything that they need that's going to help them be able to stay in their home or where they're wanting to be in those final moments. All the medications are paid for, the supplies are paid for that you need and the family needs to take care of that patient. We have a chaplain on service for spiritual support. We have a social worker for emotional support. We have certified nursing aides and home health aides that help with normal daily living activities, so bathing, light household duties. We have volunteer services that can offer companionship and respite for the families. And we also provide that guidance and education that's needed for the family and the patient as they continue to decline. Also, we have bereavement and grief support services for the family. Then that goes on for 13 months. So the next question one might ask is, who qualifies for hospice? Anyone diagnosed with a terminal condition where the doctor thinks that there's an estimated 6 months or less to live qualifies for hospice. And they can no longer be seeking aggressive treatment. So aggressive treatment consists of chemo, surgery, or seeking a specialist.
Can I ask you a question?
Sure.
What's the difference, you say hospice and palliative care?
Yes.
What's the difference?
So palliative care is comfort care and pain management while you're still seeking aggressive treatment. So say the patient had cancer,
Okay.
but still was wanting to receive their chemotherapy. Palliative care would be a route for them while they were still doing the chemo.
I didn't know that.
Yeah.
So how long can you be on palliative care? Could you be on it for years?
Yes. There's no time limits. Even though hospice has the rough guidelines of 6 months,
Right.
some may be less amount of time than that, and some may be more time than that. It just, because everybody's disease process and course runs a different path, we don't have strict guidelines on that 6 months. We take care of the patient.
Okay. And so when they're on palliative care, are you working in conjunction with, if it's cancer or if it's a heart disease, are you working in conjunction with that physician?
Yes, to help manage the pain and symptoms that the patient's having.
Also, don't you have weekly meetings where your team meets and discusses, because you have Dr. Laura Myrick is
She's our medical director.
Right.
Yes, we have our weekly interdisciplinary team meetings that consist of the whole hospice team and Dr. Myrick. And that's just a way for us to keep up and stay current on how all of our patients are doing.
Okay.
So everybody's on the same page.
And so regarding hospice, you say it's usually the guideline is 6 months or more or less. I'm sorry. Have you had someone stay on hospice longer?
Yes.
So
Years.
It's years. Okay, so it's not always. I think
It's
that's
not always cut and dry.
Yeah, and I think that's a concern with some people. I would think that if they feel that they're calling in hospice, that they're giving up.
Absolutely not. We're not here to help them give up. We're here to help them learn and manage their symptoms so they can enjoy their life.
That's great. That's great. Okay. Did you have anything else before we got to some of these myths that you wanted to talk about?
No, go ahead. Let's see.
So we're going to try to dispel some myths about hospice. You kind of covered this one, but I'm going to go ahead.
Sure.
Do you have to be in the final stages of dying to be eligible for hospice?
Absolutely not. You just have to have that diagnosis, the terminal diagnosis, and not be seeking any other aggressive treatment for it.
Okay. Why don't you go ahead? I know it's down here. We were talking earlier how a lot of people sometimes think that hospice care is only for people that have cancer. That's not true.
No, there's several different diagnoses, and most diagnoses have end stage parts of them. So cancer, heart failure, COPD, ALS, AIDS, HIV, liver failure, kidney failure, dementia, vascular dementia, end-stage Alzheimer's.
Okay. So quality care at the end of life can be expensive.
Yes.
Tell me how Chisholm Hospice helps.
So anybody with Medicare has a benefit for hospice, and that pays for hospice 100%. And also private insurances as well usually cover the hospice. But here at Duncan Regional, regardless of the ability to pay, we take care of you no matter what and give you the same care.
Great. If you choose hospice, do I have to leave my home?
No, absolutely not. You can stay in your home. You can receive hospice care wherever you want. The thing about being in the home is we help you plan for when you're no longer able to take care of yourself at home. Once that becomes a problem, then we help transition either into a nursing facility, into a family member's home, somewhere else where you can still get quality care and safe care, even though you're not able to give that to yourself.
That's great. I think that would be a great comfort to be able to stay in your own home.
Yeah.
Is hospice only for the elderly?
No, we take care of all ages, infants to geriatrics.
So, how long have you been a hospice nurse?
I've been a hospice nurse for a total of 5 years this year.
5 years. So, I think it would be difficult.
It is difficult, but we build relationships with our patients and our families that go far beyond the hospital and the sickness. I have patients and patients' families that I still talk to that I took care of as a first-year hospice nurse.
Mm-hmm.
You see them in town and their face lights up.
Mm-hmm.
You did something for them, and you helped them on one of the most difficult journeys. Everybody has to go through this, just like everybody's born.
Mm-hmm.
Everybody has to die.
Right.
And we get to be a special part of that. And not many people can say that they're there and with that patient and help that patient get to that goal.
So how do you have that difficult conversation with someone that is trying to decide if they want to place either themselves or a loved one on there? How do you have that conversation? How do you help them to see that it's not giving up, but it's providing quality life?
Complete honesty. When I go into a home, you're an outsider.
Mm-hmm.
And so as you're coming in, they have to trust you. And I think that starts with honesty. Being honest with them about where their family member's at in the disease process. Being honest with them about what we can provide. And, asking them, what are the alternatives that you've thought about? Have the whole conversation with them. Don't just tell them about what we can provide, but tell them the road of each option.
Mm-hmm.
And then kind of let them come to the decision.
What does the social worker, I think you mentioned, what does the social worker provide?
So the social worker provides social and emotional support. If there's any programs that the family or the patient may qualify for extra help in the home, extra supplies or extra needs, Rachel Sink, who is our social worker, she helps the family navigate that path. She helps with the paperwork, the phone calls. She's like a liaison to help get all the tasks finished. She helps with legal paperwork, such as do not resuscitates or advanced directives.
Mm-hmm.
She helps explain those to the family and the patient so they understand.
And I think that would be very important, especially
Mm-hmm.
since the time they're going through. So what does our chaplain, what does he provide besides the obvious?
Yeah. He's almost a respite, sort of.
Mm-hmm.
He builds very good relationships with our patients as well and keeps up with them and keeps up with the family, but obviously prayer and just a companionship. Glenn, our chaplain, he has a guitar that he likes to take and play for our patients if that's something they like. And
nice.
Yeah.
What about the volunteers? The respite volunteer. Explain what is a respite volunteer.
Right. Okay. So a respite volunteer is a volunteer who is called to hospice, and they enjoy that time with the patients. So they go in as a friend or a companion, and they sit with the patient. They try to find out what the patient likes. We have volunteers that read to patients. We have volunteers that paint fingernails, do hair. It's just another person to be in there for our patients that helps improve their quality of life. And also give a little break to the caregivers. Mm-hmm. If the caregiver needs to go run an errand and they don't want to leave the patient, it's comforting to know that there's somebody that's part of our team there to provide that for them.
I think that's great. And you had mentioned 24-hour nursing. So if you are assigned to a certain patient
mm-hmm.
and it's 10 p.m., do they get you, or is there a nurse that's on call?
There's a nurse that's on call, but the nurse is still part of our team.
Got it.
So we have 3 RNs and 1 LPN, and they rotate call. And so if you get a call or you call in at the middle of the night, you'll receive a call back from one of our staff.
Okay. So they will get someone.
Yes, absolutely.
And why don't you go ahead and tell them what is your area
our service area. So we service a 50-mile radius from Duncan Regional. So that goes north about to Nenakaw. That'll go east down 81 and east over towards the Ringling area, not quite to I-35. We go south all the way to Terrell and then west towards Lawton and about Walters. So pretty big area.
Big area. And I'm kind of jumping around. I'm sorry about
That's
that.
okay.
The bereavement program. Why don't you explain what that is? Because I don't think everyone understands. I hope that people don't think that once patient care is no longer needed, that you're gone.
Right. Yeah. So our bereavement program is a 13-month program for the families of the loved one and of the patient. For 13 months after that patient passes, we still want to keep up with you and make sure that that family's doing well.
Yeah.
So we make phone calls. We have mailings that go out in the mail and they're a grief support newsletter.
Mhm.
So there's poems and there's readings to help that person with the grief process and help them navigate those waters.
And plus, you had mentioned you most of the time make a relationship with the family. So
Absolutely.
I'm sure there's some personal time that you're talking to these families
Yes.
on your own,
Yes.
too. I can believe that.
Yeah.
And we have support groups, too.
Yes, we do. We have the grief support group that meets on Tuesday nights at the Duncan Regional Home Care Office.
Okay, Susan Gassaway is the facilitator for that. Is there anything else you can think that we should share? Like I said, hospice is a tough topic, but you've made it sound that it's nothing to be scared of.
It's not. We're here to help. We want to help. And if nothing else, we're here to answer questions. Don't wait till it's too late. It's better to ask those questions early so we can help guide those decisions and that process for you, and there's no surprises.
What's the phone number?
Our phone number is 580-251-8764.
Okay, and it doesn't hurt to call and just ask questions.
Yeah.
You're not committing anything, right?
No, not at all.
Okay.
That brings me up to another good point, though. How would one go about getting on hospice?
Yeah, that'd be great.
So anybody can self-refer. If you feel that you know somebody, or maybe for yourself, call the office. We can talk to you, and then we will start the process of getting all the orders needed from the doctor. That's nothing that y'all will have to handle.
That's great. That's a big help. A lot of paperwork at that time.
Yeah.
So, that's it. I don't have anything else. I think we covered it all.
That's good.
One last thing, though. We have the foundation sponsors the Tree of Remembrance, which is we're having our kickoff ceremony December 2nd at 5:30 in the atrium of the hospital. We're going to have some singing and some refreshments, but you can purchase an ornament for $20 and put your loved one's name on the tree, which will be there for the whole month of December. And this is a fundraiser for Chisholm Trail Hospice. Makensi alluded to it, that we take care of patients whether they can pay or not, and so that's what those funds are used for. But once again, call hospice if you have any questions. I know Makensi and any of the staff there would love to talk to you. Thank you, Makensi, and thank you, everyone. We'll see you next month.